Imagine this: you go to the doctor with what looks like a routine infection, maybe a urinary tract infection, maybe pneumonia. You're handed a familiar pill, but what if that pill fails? According to the latest report by World Health Organization, the 2025 Global Antibiotic Resistance Surveillance Report, 1 in 6 laboratory confirmed bacterial infection worldwide were resistant to at least one antibiotic in 2023. Even worse, in some regions that ratio climbs to 1 in 3. This isn't science fiction, it's real. It's creeping quietly, and the window of opportunity to act is shrinking fast. We are going to unpack the science, the numbers, the systems behind this crisis, and what it means for you, for Pakistan, for the world. Welcome to Dialectic Briefs. Let's step back and build the baseline. The WHO's surveillance system, GLASS, collected data from over 23 million bacteriological confirmed infections across 104 countries. Between 2018 and 2023, resistance rose in more than 40% of the pathogen antibiotic combinations monitored, with average annual increase to 5 to 15%. Many of our go-to antibiotics are losing punch, and this surge is accelerating. How did we get here? That brings us to the next section. This isn't just about bacteria evolving, although they absolutely are. It's about system, practices, and global inequities. Overuse and misuse of antibiotics. Prescriptions for viral infections or self-medication without diagnostics drive resistance. Weak surveillance and diagnostics. Countries with weaker healthcare system shows higher resistance level. Antibiotic classification misuse. Many healthcare systems still rely heavily on watch and reserve antibiotics rather than first-line treatments. Agriculture and One Health factors. Resistant bacteria can spread from animals to human, creating a global cycle. Combined misuse, weak systems, global travel, and evolving bacteria, you get the perfect storm. Resistance isn't evenly spread. Southeast Asia and Eastern Mediterranean, about 1 in 3 infections are resistant. Africa, roughly 1 in 5. Europe, around 1 in 10. Differences arise from limited diagnostics, over-the-counter antibiotic access, less robust infection control, and rural population challenges. For Pakistan and South Asia, this is particularly critical. A local action impact the global trajectory, but a crisis this scale requires systematic responses. When antibiotics stop working, it's more than inconvenience. Routine surgeries become high risk. Chemotherapy and organ transplant become dangerous. Even a urinary tract infection could become life-threatening. The WHO warns the first-line treatments for common infections are increasingly compromised, potentially pushing us into post-antibiotic world. Low and middle income countries will bear the brunt, including Pakistan. But we are not helpless. WHO recommends strengthen surveillance, join GLASS, improve lab capacity, report high quality data. Infection prevention and control, improve hygiene, sanitation, vaccination and hospital protocols. Antibiotic stewardship. Use antibiotics only when necessary and prioritize first-line treatments. Innovation and access. Develop new antibiotics and diagnostics, ensuring availability in low-resourced areas. One Health approach. Align human, animal, and environmental efforts. For Pakistan, this means policy reforms, lab investments, regulated antibiotic sales, and public awareness campaigns. Action must replace talk, and quickly. So, what can you do? Ask if the antibiotic prescription is necessary. Use antibiotics exactly as directed by a healthcare professional. Support hygiene, vaccination, and safe food practices. Advocate for investment in labs, surveillance, and innovation. Think globally. Resistance is a shared challenge. The 2025 WHO report is a wake up call, not just for health systems, but for all of us. Treat this as a routine, and the consequences will be severe. Subscribe for more interesting information and follow Dialectic Briefs.